Hi, my name is Claire Thomas, and I'm going to be graduating from the Bachelor of Science in Nursing program. And today we're going to do my Educated Citizen Portfolio Review. Following graduation, I will be working as a full-time registered nurse on a medical surgical unit at Methodist Fremont Hospital. Today, I will be discussing how the Educated Citizen curriculum has aided me throughout my educational journey, as well as how it's aided me in my research of my public issue and the care of my patients. My public issue pertained to my job following graduation. I decided to analyze the rates of poverty within Fremont, how it will affect my patients, the different causes, current trends, any solutions or programs in place to kind of get rid of poverty. I came from a large farm family. I had 2 brothers and 2 sisters, so a family of 7, just south of Fremont. Growing up, money was not always available to cover all aspects of essential needs. This affected quite a bit of my life as well as my siblings' lives. Rather than going to the dentist every 6 months as recommended, sometimes we had to stretch it and go every 9 months, 12 months, or just couldn't go that year. Getting annual physicals was not always on the list for us because we couldn't always afford it. So we kind of had to skip certain healthcare needs to kind of fund more pertinent issues like food, water, heat, electricity, things like that. So having been through it, I have a personal connection, just being from the area, understanding what it's like to undergo poverty, and then the different sacrifices you have to make regarding your healthcare. To begin with, the first public issue connection I made was with my effective communicator in Humanities 258, which is a world history class here at Methodist. I was prompted to create a research project regarding the development of medicine within ancient Rome from 400 to 200 BCE. Through this, I gathered data and analyzed it about who had access to healthcare, how much did it cost, what were the different methods they used, things like that. I remember specifically I learned something about how women were able to give birth in different manners depending on how much money they made. So I gathered all this data, I made a written report on it, and then I also gave a spoken presentation. Through this project, it helped me in my effective communicator skills as I learned how to discuss unpleasant topics such as mistreatment of patients, testing on humans, inability to access healthcare, as well as how to interconnect reflective individual methodology into my effective communicator skills. I can and have utilized these experiences already while addressing my public issue within Fremont. While crafting my presentation, I reflected on my experience I had had in this history class and thought about how I could adequately portray the information at hand without putting too much of my opinions in it, but also ensuring that my audience understood the severity of the situation. So I focused on the approach that included stating the facts of the situation, but also kind of give information behind them. Furthermore, for my second effective communicator, while in Nursing 450, which is our ICU rotation here at Methodist, I was caring for a patient in a progressive care unit. I noticed that she was receiving 2 very potent medications through an intravenous line, which you may know as an IV. She was receiving amiodarone, which is a rate rhythm controlling drug for your heart, with dopamine, which is a drug that kind of increases the output of your heart. These are 2 very potent medications. They are known to cause damage in tissues, veins, anything along those lines if not used properly. Noticing that these were running in the same line, I immediately went to my nurse. I was not in an authority position to change anything, do anything differently. And I just started a conversation with her. Why are we running these meds like this? Is this protocol here? Is this safe for my patient? Through this experience, I learned that it is extremely important to speak up for those that we encounter, whether it be our friends, families, or patients. By asking a simple question, I was able to prompt an important conversation that ended up changing the plan of care for the patient. I can utilize these learnings while addressing my public issue following graduation in a variety of ways. I can continue to speak up for these patients and their well-being and generate these difficult conversations when either it needs to happen or these patients are unable to do it themselves. This is primarily true when I began to work with the interdisciplinary team to link resources and needs for patients as we look to discharge and home health and things such as that. For my reflective individual, number 1, while in Nursing 210, which is our medical surgical class, which is now the specialty I've chosen, I was assigned to study a more in-depth about end-of-life care, death, hospice, nursing homes, and this such, required me to read a novel, complete a paper, and just kind of analyze my own personal biases, prejudices, beliefs, stereotypes, things such as that. For me, this was specifically regarding nursing homes, was where I felt that I was kind of having my own mentality about them, not looking at the statistics, the facts, and the reality of the situation. Through this, I learned that part of being a reflective individual is being hard on ourselves as we identify our own faults in thinking. Oftentimes, we may think being a reflective individual is looking back and thinking, oh, I did so well at this, maybe I need to improve in this, when in reality, sometimes we need to look back and realize that we were at fault and we were the incorrect person in this argument or situation. When we identify our own biases, prejudices, and stereotypes, we need to identify why they were wrong and holistically look at the situation and just understand that we are wrong. This is the more suitable way to look at the situation. I can utilize this while addressing my issue by identifying why patients are struggling with poverty and linking them with adequate resources, setting my own personal biases aside. Rather than thinking, oh, this patient is in poverty because they're unemployed, I can ask the patient, so why do you think you're in poverty? What can we do to help? And by doing so, I can more adequately link them with care and help them out of their situation. For my second reflective individual, in COMS 320, Healthcare Collaboration and Leadership, I took a test about my leadership skills, styles, and abilities. After this test, it was determined that my two top leadership traits were humor and honesty. Honestly, when I got these results, I thought I was being told I was the class clown and that I was kind of a joke as a leader. I posted my results on our discussion board with my classmates, kind of beat up about it, thinking that I was not being a good leader, I won't do well, anything like that. When my classmates responded with specific instances that they remembered where I had used humor and brutal honesty to kind of connect with them and lead in a different approach. Whether it be talking about my stupid mistake or something as such, they documented that and told me that sometimes it does really help them and it is just a different leadership style. It's not anything bad. Through this, I learned that reflecting on ourselves and our abilities does not always mean changing ourselves for the better. Sometimes it is realizing that we do bring skills and values to the table that other people might not quite bring. Moving forward, I learned that I can, could, and should utilize my humor and honesty skills when addressing all my patients, including those in poverty. I often find that humor allows me to connect with my patients on a different level, and by pulling on my own previous experiences, I'm more likely to connect with them and help them through their journeys. For my first change agent related to poverty, in the summer of 2020, this is after COVID-19 had started, I was working at a roadside produce stand in Omaha, kind of just like the little shacks you see on the side of the road. During this time, we had a lot of restrictions and mandates due to the new and upcoming pandemic. Through this, I was required to wear a mask at all times. We had to have hand sanitizer, soap, and water on hand, couldn't use reusable bags, things such as that. With this, a lot of customers felt that we were being foolish, called us sheep, told us that we were doing more harm than good, and just overall kind of made fun of us. Rather than play into this argument, try and fight back, or anything like that, I chose to kind of educate the individual saying, hey, I am in healthcare. I do get exposed to COVID-19 on almost a daily basis at this point. I'm doing this to protect you. This is not an insult on your political thoughts, your education, anything as such. I am just simply trying to protect you and those around you. Through this, I learned that being a change agent is not an easy process, and that we may be forced to require situations that are unenjoyable for those of us that are receiving, and that it is not easy to instill change and it requires effort and dedication. Through this, I can utilize this by understanding that change does not come easy. So when it comes to calling around for resources, asking for help, and linking different cares for my patient, I will utilize my learning to understand that it might be hard and there will be pushback, but I will be able to move forward and do everything necessary to instill change. For my second change agent related to poverty, in Nursing 462 Community-Based Care and Complex Aging, which is our geriatrics or elderly class here at Methodist, I visited one-on-one with an elderly individual. It was a project requiring about 8 to 10 hours of one-on-one, face-to-face time with this elderly individual. And I spent these hours gathering information about her life and creating a booklet out of it. So I asked her about her childhood, her deepest, darkest secrets, her memories, her enjoyable moments, big moments, things like that. Through this, I learned that my patient or elderly individual really benefited from social interaction, whether it been through Facebook, face-to-face, at a workout class, on a walk, anything like that. Through this, I kind of suggested that let's try and find some Facebook groups or some friends on Facebook that you can kind of connect with, meet up for coffee, do things like that. I linked her with various social groups, including Silver Sneakers, which is kind of an elderly individual's fitness class, and online Facebook groups. Through this, I was able to kind of get her to meet up with some friends for lunch that she found on this Facebook group. And actually, every Wednesday, they still go to lunch together. I think it's like 5 or 6 elderly females just sitting down having coffee, kind of just talking and chatting. Through this, I learned that being a change agent may only require changing the life of one person, not an entire community. So I may not have changed the entire Facebook world's life. I may not have changed this individual's entire town's life, but I did change her life for the better in a little bit. Through this experience, I learned that I can slowly help those in poverty within Fremont. I can't cure poverty in Fremont by myself. There's no way. So by just kind of helping one person at a time, I can start to make a difference. For example, if I was taking care of an older individual, I might help link him with resources that would get him out of poverty, and in return, his 3 children might also get out of poverty. So by using these skills moving forward, I can know that one person at a time can generate results that you may not have ever expected before. In conclusion, through my time here at Nebraska Methodist College, I have gathered various life skills throughout the Educated Citizen curriculum that will serve me well in my future career as a nurse. These skills have already begun helping me in my educational and nursing journey, and I'm excited to see how they help me following graduation as I care for those experiencing poverty in Fremont. Thank you.